All right, well, this morning, a lot of schools are already back in session. The students in Washington Township start the new year on Thursday, and we know this can be stressful. So when it comes to mental health, Gina Galeros explains that right now, it's the teachers who are learning.
With the new year at Washington Township Schools now hours away, educators spent part of their summer at West Lane Middle School preparing to welcome students.
We're going to help you to understand important processes that are related to these roles that you as a teacher need to know.
This is Jennifer Dodson, the district's lead counselor.
Every single day, our school counselors and school social workers are working with students with unmet mental health needs.
Dodson relies on data from the American Health Counselor Association. About 20% of students nationwide struggle with their mental health. Only 1 in 5 receive support, and most times it's at school.
Without a doubt, we would say we're seeing more mental health challenges now than we were 10 years ago.
Oftentimes the challenge begins before the student even arrives.
With the COVID-19 pandemic, attendance continues to be an issue that we're dealing with. We see what we call school refusal, where they don't want to come to school.
Right now, dozens of counselors and social workers are focused on being proactive instead of reactive, focused on lessons about social and emotional skills and career and college preps.
There's a lot that goes into it.
Dodson says there are also more systems in place for those students who need more attention.
We have really clear administrative guidelines and a process for handling students when they are expressing suicidal ideation and follow-up steps that we follow. And so I think we have more systems in place to address it, but the need is significant.
At home, Dodson recommends what she calls protective factors: positive role models, real connections, a trusted adult, open communication, and healthy coping skills.
I think a lot of kids need a soft place to land.
Gina Galeros, 13 News.
And well, some argue that there are more mental health concerns right now because of social media. So Dodson has these tips. She says your child shouldn't have their phone at night. She recommends keeping all the phones on a central charger away from their bedroom. And if you aren't sure if your child needs some help, Dodson says reaching out to your child's counselor or social worker is a great option. More of these tips at WTHR.com. We'll be right back.